Because this patient is due for her mammogram, we need to give her a call.
For more than 16 years, family medicine Norwalk Clinic Administrator Rhonda Montgomery has run her clinic with one simple motto.
You got to walk the walk and talk the talk.
That rings especially true when it comes to annual checkups.
I've always been one of those women that, get my yearly annual physical. When it came time for me to start having mammograms, I've always done that. I can't think of a reason why women should not do these services. Thank you.
In 2015, Rhonda scheduled her yearly exam, but a series of unforeseen circumstances kept pushing it back.
I was supposed to have my annual mammogram done in November of 15, and we were really busy here at the clinic, so I kept pushing it back. In December, I had to switch it because of a family commitment, so I switched it to January. And then in January, the truck broke down that comes out here and does the mobile mammography, and so I had to reschedule it again for February.
That mammography and subsequent tests led to a positive breast cancer diagnosis.
I remember sitting there and just thinking, this really can't be happening. I just kind of broke down a little bit. I was really surprised that I did, but it was like someone had just kind of hit me with a Mack truck. It was the last thing on my mind. It was the last thing I was expecting.
Through the shock, Rhonda said her radiologist was quick to point out the silver lining.
During the biopsy, the radiologist told me that the way that the tumor was positioned and the fact that we had caught it so early, that maybe if I had had it in November, like I was supposed to, it wouldn't have even shown up. And then, I could have been in a lot of trouble because it would have been a whole nother year, most likely, before I would have had another mammography done.
Rhonda tackled her cancer head on, and after a successful surgery to remove the tumor and 6 weeks of preventative radiation, Rhonda is now cancer-free.
It's really just given me a whole different outlook on everything, because, in the blink of an eye, your whole entire life can change. And I'm very lucky.
Becoming a cancer survivor has given Rhonda the opportunity to look at her job through a whole different lens.
I look at everything differently. I look at patients that come in here and their life circumstances and what they're trying to do for their health care. I'm an advocate of women having preventative services. I'm a mother, I'm a wife, but we've got to take care of ourselves.
Rhonda also has high praise for the care she received while going through her journey and believes her care would have been universal, regardless if she was an employee or not.
I just felt like the care that I received was outstanding, and that I wouldn't recommend any place else for anyone.
And she continues to live her motto every day at work, living proof that annual visits can save lives, even if hers took her a little off course.
I feel like I was lucky, and maybe this is why, because I'm trying to get it out to other women that this is really important, and this is the kind of outcome you can have, hopefully, of course, if you do some of these preventative things.